Hey everyone, welcome back to Dr. Tripathy YouTube channel.
Thrombosis, often referred to as blood clotting, is a condition that affects millions worldwide. While our bodies naturally form clots to stop bleeding after an injury, thrombosis occurs when clots form inside blood vessels without a trigger. These clots can obstruct blood flow, leading to serious complications. Imagine a traffic jam inside your body's intricate network of arteries and veins. This is essentially what happens during thrombosis, where the smooth flow of blood is disrupted by a blockage. This can have far-reaching consequences affecting various organs and systems. Understanding thrombosis is crucial because it often remains asymptomatic, meaning it doesn't always present noticeable symptoms. This silent nature makes it a potential danger, as undiagnosed and untreated thrombosis can lead to life-threatening situations like heart attacks, strokes, or pulmonary embolisms. The good news is that with increased awareness, timely diagnosis, and appropriate treatment, the risks associated with thrombosis can be significantly mitigated. This essay aims to provide a comprehensive overview of thrombosis, empowering you with the knowledge to protect yourself and your loved ones. Thrombosis can be broadly classified into two main types: arterial thrombosis and venous thrombosis, each affecting different parts of the circulatory system and presenting unique challenges. Arterial thrombosis occurs when a clot forms in an artery, which carries oxygen-rich blood away from the heart to the rest of the body. This blockage can restrict blood flow to vital organs like the heart, brain, or limbs. A heart attack, for example, can occur when an arterial clot blocks blood flow to the heart muscle. On the other hand, venous thrombosis affects the veins, which carry deoxygenated blood back to the heart. When a clot develops in a vein, it can cause pain, swelling, and discoloration in the affected area. A common type of venous thrombosis is deep vein thrombosis, which typically occurs in the legs. Understanding the distinction between arterial and venous thrombosis is vital for prompt diagnosis and treatment. While both types can have serious consequences, recognizing their unique characteristics allows healthcare professionals to tailor interventions effectively. Blood clot formation is a complex process involving various factors, and understanding these factors is key to preventing and managing thrombosis. While our body has a natural clotting mechanism to prevent excessive bleeding, certain conditions can disrupt this balance, leading to thrombosis. One of the primary causes of thrombosis is damage to the inner lining of blood vessels, known as the endothelium. This damage can occur due to various factors such as smoking, high blood pressure, diabetes, and high cholesterol. When the endothelium is injured, it triggers the body's clotting cascade, leading to the formation of a thrombus, or blood clot. Another contributing factor is abnormal blood flow. When blood flow becomes sluggish or turbulent, it increases the likelihood of clotting factors accumulating and forming a clot. This is often observed in conditions like atrial fibrillation, a type of irregular heartbeat, or in situations where blood flow is restricted, such as during prolonged immobility. Furthermore, certain genetic predispositions can also increase the risk of thrombosis. Inherited blood clotting disorders, while less common, can significantly elevate the risk of developing clots, often at a younger age. Identifying these risk factors is crucial for individuals to take proactive measures and work with their healthcare providers to manage their risk effectively. While thrombosis can often be asymptomatic, being aware of the potential warning signs is crucial for seeking timely medical attention. Early recognition and diagnosis can significantly improve outcomes and reduce the risk of complications. Symptoms of thrombosis can vary depending on the location and severity of the clot. Arterial thrombosis, which affects arteries, typically presents with sudden and severe symptoms due to the interruption of blood flow to vital organs. Chest pain, shortness of breath, sudden weakness or numbness on one side of the body, difficulty speaking, or vision changes can all be indicative of arterial thrombosis. Venous thrombosis, on the other hand, often presents with more gradual and localized symptoms. Pain, swelling, tenderness, warmth, and redness in the affected limb, typically the legs, are common signs of venous thrombosis, particularly deep vein thrombosis. It's important to note that deep vein thrombosis can also occur without any noticeable symptoms. If you experience any of these symptoms, it's vital to seek medical attention immediately. Prompt diagnosis and treatment are essential for preventing potentially life-threatening complications like pulmonary embolism, where a blood clot travels to the lungs and blocks blood flow. Diagnosis of thrombosis involves a combination of medical history review, physical examination, and specific diagnostic tests. Understanding these diagnostic approaches can really alleviate anxiety and empower individuals to actively participate in their healthcare journey. When a patient presents with suspected thrombosis, the healthcare provider will first conduct a thorough medical history review, inquiring about any pre-existing conditions, medications, family history of clotting disorders, and recent surgeries or immobility. This is followed by a physical examination to assess for any visible signs like swelling, redness, or tenderness. However, physical examination alone cannot confirm or rule out thrombosis. Therefore, specific diagnostic tests are crucial for accurate diagnosis. One common test is a D-dimer blood test, which measures the level of a substance released when a blood clot breaks down. Elevated D-dimer levels can indicate the presence of a clot. Imaging tests play a vital role in visualizing the clot and its location. Ultrasound, particularly duplex ultrasound, is commonly used to detect clots in the veins of the legs. This non-invasive test uses sound waves to create images of blood flow and identify any obstructions. For suspected arterial thrombosis, computed tomography angiography or CTA and magnetic resonance angiography or MRA scans may be employed to provide detailed images of blood vessels and identify blockages. Early diagnosis is paramount in thrombosis management. By utilizing these diagnostic tools, healthcare professionals can accurately identify the presence, location, and severity of the clot, enabling prompt and effective treatment. Treatment pathways. Addressing thrombosis. Once thrombosis is diagnosed, the primary goal of treatment is to prevent the clot from growing larger, reduce the risk of complications, and restore normal blood flow. Treatment options vary depending on the type, location, and severity of the clot, as well as individual patient factors. Medications form the cornerstone of thrombosis treatment. Anticoagulants, commonly known as blood thinners, are often the first line of therapy. These medications work by interfering with the blood clotting process, preventing the clot from growing and reducing the risk of further clot formation. They can be administered orally or intravenously, depending on the urgency and severity of the condition. In some cases, thrombolytic medications, also known as clot busters, may be used to dissolve the clot directly. These powerful medications are typically reserved for severe cases where immediate clot removal is necessary to restore blood flow to vital organs. Apart from medications, other procedures may be employed to remove or bypass the clot. In a procedure called thrombectomy, a catheter is inserted into the blood vessel and the clot is mechanically removed. This minimally invasive procedure is often used in cases where the clot is large or causing significant blockage. Long-term management of thrombosis often involves lifestyle modifications and continued medication to prevent recurrence. By adhering to the prescribed treatment plan and making healthy lifestyle choices, individuals can effectively manage their condition and live full and active lives. Prevention is key lowering your risk. While not all cases of thrombosis are preventable, adopting a proactive approach to reduce risk factors can significantly lower your chances of developing this condition. Simple lifestyle modifications and awareness of individual risk factors can make a world of difference. Maintaining a healthy weight through regular exercise and a balanced diet is crucial for thrombosis prevention. Obesity is a significant risk factor for thrombosis, as it can lead to increased pressure on veins and altered blood flow. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Smoking is another major culprit behind thrombosis. Nicotine and other chemicals in cigarettes damage blood vessels, increase blood clotting, and contribute to other risk factors like high blood pressure and cholesterol. Quitting smoking is one of the most significant steps you can take to improve your vascular health and reduce your risk of thrombosis. Staying active, especially during long periods of immobility like long flights or car rides, is essential for promoting healthy blood circulation. Simple exercises like ankle pumps, calf raises, and walking around the cabin every hour can significantly reduce the risk of clot formation in the legs. If you have any pre-existing conditions or are at increased risk, consult your doctor about compression stockings, which can help improve blood flow in the legs. By incorporating these preventative measures into your lifestyle and addressing individual risk factors, you can take charge of your vascular health and minimize your chances of experiencing thrombosis. The importance of early detection. Early detection plays a pivotal role in thrombosis management and can be the deciding factor between a positive outcome and potentially life-altering consequences. Understanding the significance of early detection empowers individuals to take control of their health and seek timely medical attention. Thrombosis, often dubbed a silent threat, can lurk undetected until it manifests as a serious medical emergency. This silent nature underscores the importance of recognizing potential warning signs and seeking medical advice promptly, even if symptoms seem minor or you're unsure. Early diagnosis allows healthcare professionals to initiate appropriate treatment promptly, preventing the clot from growing larger, blocking blood flow to vital organs, or breaking off and traveling to the lungs, causing a pulmonary embolism. Timely intervention can significantly reduce the risk of complications and improve long-term outcomes. Remember, you are your own best advocate for your health. If you experience any unusual symptoms, especially those related to thrombosis, don't hesitate to reach out to your healthcare provider. Early detection can make all the difference in preventing serious complications and ensuring a healthier future. A hopeful future. Living beyond thrombosis. While the diagnosis of thrombosis can be concerning, it's essential to remember that it is a manageable condition. With advancements in medical technology, treatment options, and a proactive approach to prevention, individuals diagnosed with thrombosis can lead full and active lives. The journey towards managing thrombosis involves a partnership between the patient and their healthcare provider. By adhering to the prescribed treatment plan, whether it involves medications, lifestyle modifications, or both, individuals can effectively control their condition and minimize the risk of complications. Living beyond thrombosis also entails embracing a holistic approach to health and well-being. This includes adopting a heart-healthy diet, engaging in regular physical activity, managing stress levels, and avoiding smoking. By prioritizing these healthy habits, individuals can not only manage their thrombosis but also improve their overall health and quality of life. Remember, knowledge is power. By staying informed about thrombosis, recognizing the signs and symptoms, and taking proactive steps towards prevention, you can navigate this condition with confidence and embrace a brighter, healthier future.